Hi, my name is Cheryl Monkhouse. Currently, right now, I'm working at the hospital at the Foothills as well as at Bethany Care Center. I started with ABES College on November 2017, and I graduated on May 2018. Well, what challenged me was I had lost my job through downsizing, and at the time I was searching for different jobs, and when I was doing the different jobs and looking and going online and applying, I think I applied to about 1,000 different places and I wasn't getting any responses back. So at that point in time I took a chance and thought maybe I'll go back to school and try something different and change my line of work. And that's what brought me to ABES. I actually researched different colleges and looked at ABES and a few other ones and found that I seen more opportunity with ABES to go into the clinical factors and see the different settings. And once I was able to do that, I made my choice to go into ABES, and I come in and seen Harpreet and signed up. When I was started at ABES, I was looking at the different possibilities. And they told me about I would have an opportunity to go to group homes, I would have an opportunity to go to the hospitals, I would have an opportunity to go to palliative care as well as into long-term care facilities. So that made the opportunity for me open more doors, and I was able to network more and get to meet some of the other healthcare aides in their professions while doing my clinicals. And when I went into my practicums, then it opened even more doors. So I was able to meet unit managers and different healthcare aides, different nurses, and really grow my network. And that was how I was able to find a position within the hospital. Well, before I even finished my practicum, which was at the hospital and at the long-term care facility, I had talked to the unit manager, and he had actually said to me, I'm looking for more healthcare aides. And I asked him what the possibility of signing on for him, and right there and then I was offered the opportunity to have an interview. And I interviewed just before I finished my practicum, and I was hired pretty much on the spot, and I started in the next month at the hospital. And about 2 months later, I was also applied for a position at Bethany Healthcare Center and the new one in Dover, in which I was allowed to get a full line, so I was able to work there as well. So now that works with my availability with my family, and my time with them is more relatable to my jobs. My family is very important to me, and my husband works pretty much Monday to Friday, 9 to 5 job. And I was looking for something in my old job. I would work anywhere up to 12 to 15 hours a day. So I was really overworking and not spending enough family time. So doing the job that I'm doing right now, I'm working casually at the hospital, I'm working part-time at Bethany Care. I work kind of the Monday to Friday, 7 to 1, and then picking up shifts wherever I want to. So it creates more family time for me, and it allows me to also get more involved in my family that I didn't have before. I think it's a great opportunity to open doors for you. I think if you ever get a chance to, it's a great field, because you know that you're helping people. And I think that's the biggest reason why I wanted to do this job, is because I'm very good with seniors and working with people, and I felt that this was a time that I could try something different and get away from what I was doing in my previous career. I think the teachers made me very proud. It was a very good opportunity, but I found that the teachers were so experienced, and they'd give you so much foresight into what you were going to be learning and doing, that you felt very comfortable in what you were doing. And that made me pretty happy in finding that position that I was available to do.